How are surgical interventions used for otosclerosis hearing loss? When it comes to otosclerosis, many people wonder how surgical interventions can help with hearing loss. Otosclerosis is a condition that affects the bones in the middle ear, particularly the stapes bone. This abnormal bone growth can cause the stapes to become fixed, preventing it from vibrating properly and leading to conductive hearing loss. Fortunately, surgical options are available to address this issue. The primary surgical procedure for otosclerosis is called a stapedectomy. During this operation, the surgeon removes all or part of the immobilized stapes bone. They then replace it with a tiny prosthetic device, usually a small piston. This prosthesis connects the incus, another bone in the middle ear, directly to the inner ear. By bypassing the fixed stapes, sound vibrations can once again reach the inner ear, restoring hearing. Another technique related to this is called stapedotomy. Instead of removing the entire stapes bone, the surgeon creates a small hole in the footplate of the stapes and inserts a prosthesis. This method can sometimes lead to better hearing outcomes, especially at higher frequencies, and it generally has lower complication rates. However, the surgeon's experience plays a crucial role in the success of either procedure. Typically, the surgery lasts about 1 to 2 hours and is often performed on an outpatient basis, meaning patients can go home the same day. After the procedure, patients are advised to avoid strenuous activities for about a week. Many people notice an improvement in their hearing within 4 to 6 weeks as their ear heals. It is important to understand that, while these surgeries can effectively improve conductive hearing loss caused by stapes fixation, they do not address any sensorineural hearing loss that may also be present. Sensorineural hearing loss involves damage to the inner ear or auditory nerve, and surgery will not restore this type of hearing loss. The outcomes of these surgical interventions are generally positive. Approximately 90% of primary surgeries successfully close the air-bone gap, which measures the difference between air and bone conduction hearing thresholds. However, as with any surgery, there are risks involved. A small percentage of patients may experience sensorineural hearing loss as a result of the procedure itself. Revision surgeries tend to carry higher risks. For individuals who are not suitable candidates for surgery, or for those who also have sensorineural hearing loss, hearing aids may be recommended. Hearing aids amplify sound, helping the inner ear process it more effectively. In more severe cases, cochlear implants may be considered. While hearing aids can assist with sound amplification, they do not stop the progression of otosclerosis. In summary, surgical interventions for otosclerosis are effective treatments for conductive hearing loss. They work by restoring the mobility of the middle ear bones through the prosthetic replacement of the stapes. This type of surgery requires specialized expertise and careful patient selection. It is often part of a broader management strategy that may include hearing aids or cochlear implants, depending on the individual's specific hearing loss situation. Always consult with a healthcare professional to discuss the best options for your hearing health.